So, Kim, what's on your radar?
Well, last week on his show, Joe Rogan, the host of the world's most listened to podcast, expressed his frustration with Fauci and other health officials for failing to admit when they just don't know. Rogan teared into Fauci on the Joe Rogan Experience and blamed him for mistrust in science, saying, quote, "There's also a problem with people like him where they make these statements that you're led to believe they have an understanding of the situation, but then it turns out they're 100% wrong. But then they come up with a new statement, and you're supposed to believe that," Rogan said. When they don't know, they never say, "We don't know." They don't say, "This is very confusing, and we're trying to figure it out as we go along." Now, Rogan isn't alone in his frustration. Millions of Americans remain unvaccinated, refuse to wear masks, were adamantly against lockdowns. And now with the booster shot coming, many who currently did get the 2-dose vaccine are saying they don't intend to get the third.
You know, because like now they want us to do all these boosters we were talking about with Andrew. I mean, I don't want a booster. Look, I never wanted the vaccine. I took one for the team. And by the way, you know who doesn't get a lot of vaccines? The millennials. I know a lot of millennials, especially the 20-olds. They don't want it. They don't want it. They don't think they need it. They're probably right. But I tell them, I didn't want it either. I took one for the team. But every 8 months you're going to put this shit in me? I don't know about that. Maybe I don't need one. I don't want a one-size-fits-all.
Many of the news outlets and people in our own families, communities, and friend circles place the blame squarely on the anti-vax, mask, lockdown crowd for the pandemic continuing, screaming at them to just follow the science, as if this crowd is turning to pagan rituals of spell casting instead. And the current talk of mandates and passports are often not discussed as a matter of public health, but almost as a form of punishment for the unvaxxed, a modern-day witch hunt, if you will. But can you really blame people for not listening to the public health officials when they, like Rogan stated, so often seem to counter their own directives, change them, or end up being flat wrong? In regards to mask mandates, in February and March of 2020, every major public health institution and numerous experts asserted masks weren't necessary for healthy people. The U.S. Surgeon General even tweeted, quote, "Seriously, people, stop buying masks. They're not effective in preventing general public from catching coronavirus. But if healthcare providers can't get them to care for sick patients, it puts them and our communities at risk." Fauci asserted the same thing, saying there's no reason to be walking around with a mask. Harvard public health experts agreed with the Surgeon General and Fauci, saying masks offered little, if any, protection and were more of a reflexive reaction to anxiety over the pandemic. The CDC director at the time, Dr. Robert Redfield, told Congress healthy people should not wear a mask. But by April of 2020, the tune drastically changed. The Surgeon General was demonstrating to the public how to make cloth face masks. The CDC was advising masking in all public settings where 6 feet of distance couldn't be maintained. Fauci claimed the only reason why he said what he said was to preserve inventory for medical professionals. But not everybody changed their stance, leading to even more public confusion. The WHO maintained masking was unnecessary for the healthy public until later in the year. Many other health professionals debated and still debate the effectiveness of masking. When it came to lockdowns, what started as a plea by healthcare workers to help slow the spread to prevent overwhelming hospitals turned into locking down until we crushed the virus and ended the pandemic. In April of 2020, Fauci warned easing lockdown measures too soon would lead to a big spike in cases. But by May of 2020, Fauci began to warn against extended lockdowns, claiming they could result in irreparable damage and unintended consequences, including for health. Nonetheless, despite Fauci's warnings, local public health officials and politicians continued to enforce extended lockdowns in parts of the country. Then there are the vaccines. When masking didn't end the pandemic and lockdowns didn't either, the public and health officials hoped the vaccines would be the magic bullet. But despite both CEOs from Moderna and Pfizer saying COVID will never go away and will likely be with us forever like the flu, that their vaccines will likely be annual, many public health officials in the news media have asserted the pandemic will end if everyone gets the vaccine. Fauci himself stated he didn't think it was likely COVID was ever going away, knowing what we know about immunity and coronaviruses. But confusingly, around the same time, he was also saying he believed we needed 60 to 70% of the country immune in order to reach herd immunity. But he didn't stop there. A month later, he began saying in television interviews 75% was needed, only to then change it up to upwards of 85% in an interview with CNBC. What was going on? Well, in a telephone interview, Fauci admitted he was moving the goalposts. He claimed partly based on new science and partly based on what he thought Americans were ready to hear. And that goalpost shift isn't just for the percentage of to reach herd immunity. Some countries, like Israel, have reached very high levels of vaccination and yet are in a major surge of cases, hospitalization, and deaths, showing the vaccine wanes in effectiveness against the Delta variant. Because of the new data emerging from Israel and other countries, what was once a 2-dose vaccine to be considered fully vaccinated has now shifted to 3 doses. And now fully vaccinated people must wear masks as data continues to emerge that they are just as infectious as unvaccinated people, bringing us back to the hypothesis first stated by the vaccine CEOs and even Fauci himself that this virus is likely to become endemic, meaning it will be with us forever, like the flu. Now, we can't fully blame the scientists. Part of the scientific method is guessing, testing, and either failing or confirming, and then doing it all over again. Because this is a novel virus and a situation many of these experts haven't found themselves in before, it's understandable that they would get some things wrong. But the problem is the misleading statements and the definitive assertions. They've said, do this and this will happen. Lock down and the virus will go away. Wear a mask and the virus will go away. Take the vaccine and the virus will go away. And then are forced to backpedal and reverse their statements entirely into a more nuanced stance. But this hasn't come without serious harm to our lives. Despite the obvious effects the pandemic has had on us all, we have suffered immense community erosion. Because the authorities have flip-flopped around, people are picking and choosing which contradictory statements to believe. Families, friends, and neighbors are now pitted against one another, with Team A and Team B both able to cite the exact same experts for their differing opinions. They should have told us from the beginning this was going to be scary, because they couldn't give us definitive answers on something new and unknown, that their directives would shift as they knew more. They should have been open to testing and investigating any and all theories rather than resorting to censorship and delegitimizing experts and scientists who had differing opinions, many of whom ended up being accurate. But they didn't. In many cases, they did the opposite of what was needed to build public trust. So, Alyssa, I'm curious if you think had the officials been more upfront with, we just don't know, that would have actually helped, or do you think that would have made things scarier for people?
So I think the overall great topic and very well said. So I was in the White House during the early days of the pandemic when we were sorting through this different data. And I tend to agree with your assertion that had we just come out and said, this is a totally novel virus, we simply do not know on certain things, these are our recommendations, but they may change down the road, that would have at least set kind of a trajectory of increased public trust. I do know Surgeon General Jerome Adams, who you cited, at the time had advocated for not wearing masks, and that was an internal decision we made because people were hoarding them and we didn't have enough for frontline workers. But in retrospect, it would have been much better to say, we need to preserve these for frontline workers, do not buy them. But I remember weighing this question in the Situation Room, and part of the discussion was, but if we say that, there is a portion of the public that's going to think, well, goodness, I need to go buy them even more now. Things are getting worse. So you're always balancing the fear of the unknown with giving the best information and trying to predict what people's habits are going to be. There's so much we could have done differently. I'm the first to say that, but there were a lot of different dynamics at play. Ryan,
right. Yeah.
Okay.
Yeah, I mean, I agree that was a huge mistake to talk about the masks in that context, because it also made no logical sense. Wait a minute. So masks work for healthcare workers inside a hospital, but there's something magical about the walls of the hospital that when you leave there and you go into a grocery store or inside a congressional building or something else, that now masks aren't effective for the public, but they are for health workers. So it treats people like they can't even sort through these kind of basic elements. So I think it would have been better to say, look, cloth masks are effective. N95s are better. Leave those for the nurses who are interacting with people who are currently positive. You should make your own cloth masks at home. Let's have a national effort to produce as many as we can as rapidly as possible. But I did want to talk about the Israel numbers for a second, because a lot of people are panicking about Israel, and I think it's important to put into context what happened. So, like, about 6 months ago, Pfizer, they went 100% Pfizer, and so just as the Pfizer's effectiveness is starting to wane, you have Delta coming in and producing these breakthrough infections. But what's really important is that even though the case numbers in Israel are the same as they were at the absolute peak, the number of deaths is down by more than 2/3. So even the waning vaccine is offering some significant protection. Among people over 60 who are in the hospital, you're 9 times more likely to have been hospitalized and get a serious infection if you were unvaccinated, if you're over 60. For under 60, the data shows that you're about twice as likely to get a serious infection if you're unvaccinated relative to vaccinated. And so, but people keep focusing on this statistic that roughly half of the people in the hospital were fully vaccinated. But that's because 90+% of the population is fully vaccinated. So even though you're 9 times more likely to get hit with it if you're unvaccinated, there's such a small population. Basically, everybody who's unvaccinated is getting whacked right now and going to the hospital. And then a very small portion of the people who are vaccinated are getting hit and going to the hospital. So basically, the takeaway from that should be people who are vaccinated are much safer, even though it is true that it's waning. And man, it is unpleasant to think about the possibility that there might have to be boosters to keep this vaccine effectiveness going for the rest of our lives. We don't want to admit that we might be living in that world the rest of our lives. Well,
and one point that I've tried to make to some of my friends on the right, I think people are validly upset over this. They're tired of the government changing, the goalposts and saying, now you need this, now you need this. But one can't be anti-mask, anti-vax, and anti-lockdowns unless you're pro-virus. You have to be okay with one of these mitigation tactics and willing to do it unless you're saying, I'm just going to let the virus thrive for those around me. So that's the one point I would make to people. There are still obviously decisions that you can personally make for your health on whether or not to get vaccinated, but then observe these other mitigation tactics, because we are seeing hospitalizations go up. We're seeing kids get it more, especially in the South, and we're seeing Louisiana, they're at hospital capacity or ICU capacity. Like, we've got to be willing to do something to mitigate it. But of course, the science does seem to be ever evolving, and we need to be learning as we go.
Yeah, I mean, it definitely is a constant shift, and we have to be ready for that. So, Ryan, look forward to hearing what's on your radar next.